Get right to it. First question. Which amino acid is basically like the VIP for serotonin production in the brain? Is it A, glutamine, B, tyrosine, C, tryptophan, or D, phenylalanine?
Ooh, this is a good one. Think about those classic comfort foods, the ones that just make you feel good.
Like cheesy pasta, turkey, chocolate, that kind of thing.
Exactly.
So is the answer C, tryptophan, because it's in those foods.
You nailed it. Tryptophan is what your brain needs to make serotonin, and it's pretty wild that the levels of tryptophan in your brain can actually change based on what you eat.
So there really is a connection between food and mood.
Absolutely.
Wow. Okay, next question. How does serotonin's party in the synapse finally come to an end? Is it A, metabolism by monoamine oxidase, A, reuptake by the serotonin transporter, SERT, C, diffusion away from the synapse, or D, internalization by postsynaptic neurons?
Okay, so imagine serotonin molecules are like on this tiny dance floor in your brain, right? The synapse. After they've delivered their message, they don't just vanish.
There's got to be some kind of cleanup crew, right?
Exactly.
So is the answer B, reuptake by the serotonin transporter, like a tiny vacuum cleaner?
Spot on. The serotonin transporter, or SERT, scoops those serotonin molecules right back up into the neuron that released them in the first place.
So it's all about regulating that serotonin signal.
Yep, and that's where those SSRIs come in, those antidepressants.
Right, the SSRIs. Because they block that reuptake, so more serotonin hangs out in the synapse.
Precisely. Boosting that signal.
Super interesting. Okay, on to question number 3. Which serotonin receptor subtype is kind of like the odd one out because it acts as a ligand-gated ion channel? A, 5-HT1A, B, 5-HT2A, C, 5-HT3, or D, 5-HT4?
Think of these receptors like doors on brain cells.
Okay, different doors for different signals.
Right, but the 5-HT3 receptor, it's a bit of a rebel.
A rebel door.
Yeah, most of the others are these things called G protein-coupled receptors, but 5-HT3, it's a ligand-gated ion channel, so when serotonin binds to it, it just opens up a channel and ions start flowing.
Like a direct line.
Exactly.
So C is the answer, 5-HT3.
You got it. And this receptor is a big deal for things like nausea and vomiting. That's why we have medications that block it.
Makes sense, to help with like the side effects of chemo and stuff.
That's one of the main uses, yeah.
Wow, so tiny receptors, huge implications.
Yeah.
All right, next question. Which of these drugs is basically like that VIP pass specifically for the 5-HT1F receptor to like fight off migraines? Is it A, sumatriptan, B, rizatriptan, C, lasmiditan, or D, zolmitriptan?
Okay, think about how those migraine medications work.
This sort of like constrict things, right? Like blood vessels?
You're on the right track. The answer is C, lasmiditan. It's like it has this unique key for the 5-HT1F receptor.
And by activating it.
It helps stop migraines.
Wow, a targeted approach.
Exactly. Now the others, those triptans you mentioned, those work on different serotonin receptors, but lasmiditan is more specific.
Okay, interesting. On to question 5. Serotonin's busy in the brain, but it's also working hard elsewhere in the body. Which serotonin receptor subtype is behind platelet aggregation, that crucial clotting process? A, 5-HT1B, B, 5-HT-TAC, 5-HT3, or D, 5-HT4?
Think about what happens when you get a cut.
Well, the blood clots, right.
Right, and platelets are key players in that process.
So is it B, the 5-HT2A receptor?
You're absolutely right. When you get a cut, platelets rush over and release serotonin, and then that serotonin binds to 5-HT2A receptors on other platelets, and they all start sticking together to form a clot.
Amazing. This one tiny neurotransmitter is like everywhere, doing all this important stuff. All right, moving on to question 6. Where is the majority of serotonin actually made and stored in the body? Is it A, raphellonuclei of the brainstem, B, enterochromaffin cells in the gastric mucosa, C, platelets, or D, pineal gland?
This one might surprise you. The brain definitely needs serotonin, but it's not the main production site.
Wait, are you telling me most of the serotonin in my body is actually in my gut?
You got it. Your gut is like a serotonin factory. Those enterochromaffin cells are constantly churning it out, which is super important for things like digestion.
That is so wild. I never would have guessed.
It's pretty amazing, right?
Okay, on to question 7. We've talked about medications blocking serotonin reuptake, but some actually block specific serotonin receptors. Which serotonin receptor subtype antagonist is the go-to choice for dealing with chemotherapy-induced nausea and vomiting? A, allosterone, B, ondansetron, C, granisetron, or D, polonosetron?
Remember that receptor we talked about earlier, the one that acts like a direct line and plays a role in nausea?
right? The 5-HT3 receptor. So the answer is B, ondansetron, right?
You are on fire today. Ondansetron blocks that 5-HT3 receptor, which helps reduce those awful feelings of nausea, especially for folks going through chemo.
Like it's stopping those I feel sick signals.
Exactly.
Okay, this is all so fascinating. All right, on to question 8. Migraines are the worst. What's the secret weapon of those triptan medications in tackling those headaches? Is it A, inhibition of serotonin synthesis, B, agonism at 5-HT1B1D receptors, C, antagonism at 5-HT2A receptors, or D, blockade of serotonin reuptake?
Remember how lasmiditan targets a specific serotonin receptor? Well, triptans work similarly, but on different receptors.
So they're kind of mimicking serotonin's action on those receptors. Is the answer B, agonism at 5-HT1B1D receptors?
Exactly. They activate those receptors.
And that causes...
It constricts blood vessels in the brain and reduces inflammation, which are key players in migraine pain.
Okay, so they're like stepping in and doing serotonin's job in a super targeted way.
That's a great way to put it.
Amazing. On to question 9. Medications can be amazing, but they often come with side effects. Which of these is not a typical side effect of taking triptans?
Right.
A, paresthesias, B, dizziness, C, hypotension, or D, chest pain?
Think back to the effect triptans have on blood vessels.
Oh, right. They constrict them. So wouldn't that actually lead to higher blood pressure?
Yeah.
The answer must be C, hypotension.
You are absolutely correct. Hypotension or low blood pressure is not typically a side effect of triptans. The others, though, like paresthesias, that tingling feeling, dizziness, and chest pain, those are all potential side effects.
It's a good reminder that even helpful medications can sometimes have downsides.
Absolutely.
Okay, on to question 10, our final serotonin question for this section. We've covered migraines, nausea. Now let's talk about something a little more intimate. Which serotonin receptor subtype does flibanserin target to help treat hypoactive sexual desire disorder, or HSDD, in premenopausal women? Is it A, 5-HT1A, B, 5-HT2A, C, 5-HT3, or D, 5-HT7?
This one's really interesting because it shows how complex these neurotransmitter interactions can be when it comes to behavior.
Okay, so how does flibanserin work?
Well, it actually works on 2 receptors, not just one.
Oh, wow, so it's like a double agent.
Exactly. It's an agonist at cortical 5-HT1A receptors and an antagonist at 5-HT2A receptors. The idea is that this combination might help rebalance serotonin signaling in certain brain regions linked to sexual desire.
That's fascinating. It really shows how much we still don't know about the brain and how these chemicals can impact our experiences.
Absolutely. There's so much more to uncover.
Yeah.
All right, let's switch gears now and dive into the world of dopamine.
Oh, yes. Dopamine, the reward chemical. Tell me everything.
Okay, well, first up on our dopamine journey, we got to figure out what's the rate-limiting step in dopamine production. Is it A, conversion of phenylalanine to tyrosine, B, conversion of tyrosine to L-dopamine, C, conversion of LDOPA to dopamine, or D, transport of tyrosine into the brain?
Rate-limiting step. That sounds a bit intimidating.
It's simpler than it sounds, really. It just means it's the slowest step in the whole process.
Like a bottleneck.
Perfect analogy. It's the traffic jam that determines how much dopamine actually gets made.
Okay, so which step is causing the backup? Is it B, the conversion of tyrosine to L-dopamine?
You got it. That conversion is controlled by an enzyme called tyrosine hydroxylase, and it's super tightly regulated.
So it's like tyrosine hydroxylase is the key to unlocking dopamine production.
Exactly. It's a big deal.
All right, on to the next question. Which enzyme is responsible for transforming L-dopamine into dopamine? Is it A, aromatic L-amino acid decarboxylase, AADC, B, tyrosine hydroxylase, C, monoamine oxidase, B, MAOB, or D, catechol-methyltransferase, COMT?
We were just talking about how L-dopamine is like the precursor to dopamine, right? So we need the enzyme that does that final transformation.
So it must be aromatic L-amino acid decarboxylase. Even the name sounds like it's taking something away from L-dopamine to get to dopamine.
That's a great way to think about it. AADC removes the carboxyl group from L-dopamine, and bam, you've got dopamine.
It's like a molecular sculptor,
Yeah.
right? Chiseling away to reveal the masterpiece.
I love that.
Okay, on to question 3. After dopamine's done its job, it gets broken down. What's the main metabolite or breakdown product of dopamine in the body? Is it A, 3-4 dihydroxyphenylacetic acid, DOPAC, B, homovinylic acid, HVA, C, 3-methoxytyramine, or D, dopamine sulfate?
Imagine dopamine leaves behind these little traces when it's broken down, like metabolic footprints.
Oh, so we can track its activity by looking for those footprints.
Exactly.
And is the main footprint B, homovinylic acid?
Bingo! HVA is like dopamine's calling card.
A dopamine fingerprint. That's so cool. Okay, on to question 4. We talked about serotonin receptors, so now let's talk dopamine receptors. Which dopamine receptor subfamily is the one that, puts on the brakes, coupling T-those proteins to inhibit adenylyl cyclase? Is it A, D2-like, B, D1-like, C, both D1-like and D2-like, or D, neither D1-like nor D2-like?
Think of it this way. Receptors are like doors on cells, and when something binds to them, they can trigger all these events inside the cell.
Okay, so what's happening in this case?
We're looking for the receptor subfamily that actually inhibits adenyl cyclase.
Like stops it from doing its thing.
Exactly. And are those party poopers the D2-like receptor?
D2-like, yes.
You got it. The D2-like receptors, which include D2, D3, and D4, they're the ones that work with those GOs proteins, and those proteins are basically putting a stop to adenyl cyclase.
Like the bouncers at the dopamine party, making sure things don't get too crazy?
Perfect analogy.
Love it. Okay, question 5. We've discussed how medications can target specific receptors, and sometimes they act as inverse agonists. Which drug is like a skilled negotiator, acting as a potent and selective inverse agonist at 5-HT2A receptors to help combat hallucinations and delusions in people with Parkinson's disease? Is it A, risperidone, B, olanzapine, C, pimavanserin, or D, aripiprazole?
This question highlights how medications can be so carefully designed to tweak specific receptor activity. So we need the drug that specifically dials down the activity of the 5-HT2A receptor, which is involved in those psychotic symptoms.
So is it C, pimavanserin, acting as an inverse agonist on those 5-HT2A receptors?
That's the one. Pimavanserin is special because it doesn't just block the receptor, it actually decreases its baseline activity.
It's like turning down the volume on those hallucinations.
Exactly.
Wow, that's amazing. Okay, on to question 6, and this one's a little bit scary. Which neurotoxin is like a Trojan horse sneaking into dopaminergic neurons through the dopamine transporter and causing damage? Is it A, MPP plus, B, 6-OHDA, C, reserpine, or D, cocaine?
This is a good reminder that dopamine neurons are vulnerable to certain toxins, and this one is particularly sneaky.
So which was the ultimate betrayer? Using the dopamine transporter to get in and destroy those precious neurons. Is it A, MPP plus air?
You're right, it is MPP plus air. It's a metabolite of a compound called MPTP, and it's particularly nasty because it specifically targets dopaminergic neurons. It latches onto the dopamine transporter, sneaks inside, and causes damage, eventually leading to cell death.
That's terrifying. Okay, on to question 7. The limbic system, also known as the brain's reward center, is heavily influenced by dopamine. Which dopamine receptor subtype is like the king of the limbic region, often implicated as a potential target for treating substance use disorders? Is it A, D1, B, D2, C, D3, or D, D4?
This one really shows dopamine's role in reward and addiction. We're looking for the receptor subtype that's like the main player in the limbic system, the one that's potentially driving those addictive behaviors.
So is it C, the D3 receptor, calling all the shots in the limbic system?
You nailed it. The D3 receptor is highly concentrated in limbic regions, like the nucleus accumbens, which is all about processing reward and pleasure.
So because it's so involved in reward, scientists are looking at it as a target for treating addiction.
Exactly. It's like trying to rewire the brain's reward system.
That's really interesting. Okay, on to question 8. We talked about how serotonin receptors are like doors, and some of those doors come in different variations. Which dopamine receptor subtype is known for having a lot of different forms, or polymorphisms, with one specific variant being linked to ADHD? Is it A, D1B, D2, C, D3, or DD4?
This question shows just how much genetic diversity there is in dopamine receptors and how even small changes can affect brain function and behavior.
So which receptor is like a door with the customizable lock having the most variations? Is it D, the D4 receptor?
You are absolutely right. The D4 receptor is highly polymorphic, and one particular variant, the 7-repeat VNTR, has been linked to ADHD.
Wow, so that variation could be part of why some people develop ADHD.
It's one piece of the puzzle, for sure.
Okay, question 9. Some medications work by messing with the dopamine transporter, that little vacuum cleaner that removes dopamine from the synapse. Which drug is a dopamine transporter inhibitor used to treat both depression and help people quit smoking? Is it A, methylphenidate, B, bupropion, C, cocaine, or D, amphetamine?
Think about what happens when you block the dopamine transporter.
Well, if the transporter is not working, dopamine would just stay in the synapse longer, right, leading to a stronger signal. So is the answer B, bupropion.
Yes. Bupropion is a dopamine transporter inhibitor, and it's prescribed for both depression and to help people quit smoking. It's interesting to note that the other options you listed also affect dopamine, but in different ways and for different reasons.
Right, so even though they all target dopamine, they have different effects.
Exactly. It's all about the specifics.
Okay, on to our final dopamine question for this section. Dopamine isn't just about reward and pleasure, it's also involved in regulating blood flow. Which dopamine receptor subtype is responsible for dopamine's blood vessel widening effects at low concentrations? Is it A, D1, B, D2C, D3, or D4?
Think about what happens when blood vessels dilate or widen.
Well, blood pressure goes down, right? So the answer must be A, the D1 receptor.
You are on a roll. At low concentrations, dopamine mainly activates D1 receptors in blood vessels, causing them to dilate and lowering blood pressure. That's why dopamine is sometimes used in hospitals to manage heart conditions.
Wow, that's fascinating. Wow, I feel like we just ran a marathon of neurotransmitter knowledge.
Right.